Come here, I got a wee secret to share with you. In this video, I go over how we got a couple dozen nurses to raise their hand, accept job offers with a client in rural Alaska, say we want to move to rural Alaska, how we sold it, how you do recruitment marketing to get people to move into Alaska, and how I hope this spurs some ideas you can use Rural Health Transformation Program funds to do the same for your organization. So enjoy the video, and I hope you find it useful.
So, number one, strategy. We looked at what made the client's area and their organization unique and interesting and offered a different value proposition to nurses who may be living in cities like San Antonio, Texas, Los Angeles, California, Portland, Oregon. What we discovered were a few things. First of all, if you're familiar with Southeast Alaska around Sitka, you'll know that there's actually a rainforest there. And while people might have conceptions of Alaska as a cold all year round place, it's quite temperate climate. So we looked at that and we thought, well, maybe we can challenge some misconceptions about Alaska and show people, well, here's a part of Alaska maybe you don't know or you haven't interacted with. We looked at the rainforest in the area. We looked at the various kind of islands which people could travel to. And we looked at tourism and connectivity to the contiguous 48 states. We came up with an idea about that region, which presented it as something which was different and interesting to people living in our target states. Now, this was really based on what is the life of the people in our target states. So, for example, looking at Texas. Texas is a lot warmer, a lot more humid and hot in the summer, particularly. It's a different milieu, it's a different environment. There's a lot less awe-inspiring nature compared to what you would get in Southeast Alaska. We compared those two things. What are our target candidates' lifestyles like? What's their area like? And what's our area like? And how is it better in certain respects? Obviously, not all respects. And then we devised a marketing campaign that contained that. Alongside this, we added in the client's organization. So we looked at their structure, we looked at their hospitals, we looked at how they treated their staff, and we wanted to present something that was different to how things were done in our target states. So how did our Tribal Health Consortium do things differently than a for-profit hospital in San Antonio? What we discovered was quite interesting. So a lot of candidates, particularly in the cities, are frustrated on how healthcare is set up, how it works, how it's run, for-profit elements, insurance. There's a lot of sort of grievances, particularly among healthcare workers. In our client, we noticed that whilst those things were still there, whilst there's still tensions, it wasn't a for-profit organization. It had a mission, particularly its ownership. Through the Tribal Health Consortium had a story to tell. So they had a kind of a stronger culture where they're rooted in their community. They even have remote clinics for people that are based more inland, eastern, hundreds of miles away. And through this, we were able to show, like, if you're working in a for-profit hospital in a busy city, you could do something different. Like, life could be different. You could escape it, get into nature, have an Alaskan adventure. All these kind of taglines do work, and people are interested in moving to Alaska. You just need to know what to say and what makes your organization, your location, different to what they're experiencing now. Next, we devised a recruitment marketing candidate screening campaign that broadcast across social media our value proposition and our client's organizational value proposition to people that weren't actively on the job market, but were in the job market in the sense where they would be open to apply to something new, different, better, but they're not really seeking it right now. So if you're trying to post ads on Indeed, for example, you are rather limited to candidate interest. It's only going to let you post really in your local area. So if someone's in San Antonio, they're looking for jobs, they would have to be looking for jobs in Alaska to apply. So say you're up in the Bristol Bay, the people of San Antonio, I'm not sure, are overly familiar with Bristol Bay, even though it's a lovely place, and they're not searching for jobs in Bristol Bay. Now, you might get one or two that has a reason to go there or has came across Alaska in a different way, but ultimately you need to be talking to people outside of the job boards, people that aren't actively seeking new positions but would be open to a lifestyle change. Everyone wants a lifestyle change. Everyone wants to improve their living environment. That's the reason we chose social media. So Instagram, Facebook, a little bit of TikTok as well, to put out, here's the area. Are you sick and tired of your area? Here's our area. Here's what happens here. Is it better than what happens there? And really give people the opportunity to open the crack in the door and peer through and think about how their life could be different in Alaska. There's a great story to tell in Alaska. The nature is unrivaled in any other state. That's what you need to be putting out there. So it's not a focus on the pay. You can't win there. It's not a focus on career opportunities, and it's not warm, sunny weather. It's the geography, it's the nature, it's the wildlife, and it's really the opportunity to turn a new leaf, make a new step in life for people that are kind of sick and tired of where they are. And I know we are playing on some stereotypes here, but to be honest, we need to find a way to connect with people. And we're not going to connect them with a $5,000 sign-in bonus. We need to recognize that Alaska is beautiful and people want to explore beauty, and people don't have enough beauty in their lives in many cities. So that's why it's important. Get out there, be active, get on social media, do paid promotions in areas where candidates live, big cities particularly, and show them that difference in life opportunity. Now, how do you do this? Well, you could engage an agency like us, number one, or that's what our client did. Or you get coordinate with your internal marketing team to say, we need to make a change here. Here's our plan. Can we work together on this? Can you help us run some ads? Let's find a collaboration here that actually benefits the organization as a whole by bringing more people to the area. Small numbers of candidates can make big differences in rural Alaskan communities. So hopefully they would be on board with it. The third way is quite interesting and new. The Rural Health Transformation Program is investing $50 billion of grant funds into rural health. I predict about $10 billion that is going into healthcare. And in Alaska, let's say about $100 million, if we portion out sort of average across the states. This is a great opportunity to get the government to pay for this, the federal government, and you want to look into those grants. So look out when they come up. We're tracking it quite closely, the Rural Health Workforce Transformation Hub, so you can follow along there. But that's a great way to fund this, and bring in other outsider agencies like ours that could help you implement this. Finally, we have housing. I know it's a topic and it's sometimes an issue in rural communities. Where are people going to actually stay? Well, you need to partner really, and you need to invest in this. You need to partner with local realtors. You can partner with local housing providers. You can partner with other healthcare providers to together invest in temporary accommodations so that whenever potential candidates come and visit or new hires come to stay, they have housing where they can follow through. So our client actually built homes. They built homes for candidates that were coming to their area. That's crazy, but it works, and it's a great idea. So consider this. Think about how you can use the land in your area, use your capital investments to go in and build housing for staff that will really smoothen that transition. Because there's a lot of barriers between people accepting a job offer and actually moving, and we saw that in our campaign. If there's housing, it just removes a barrier. It makes it a lot easier for them to say yes. Just remove one of the many objections that they might have. So, housing it is. Invest in it. So to summarize, think about it strategically. You need to consider what makes your area amazing, what makes your organization amazing, and who you're going to target. So what would a doctor be unhappy with if they're living in New York or any city really? Pick a city. Make your ads and your offer specific to that location. Secondly, recruit outside of job boards. People aren't actively seeking jobs in Alaska. That's why there's a shortage. Some are, but not enough. You need to go out on social media and connect with people outside of their working kind of environments in their free time. Present a lifestyle offer instead of a job offer first. And finally, housing. Sort the housing situation out. Partner with local providers of housing, partner with local realtors, or even build your own homes. That way, we can get more people into rural Alaska, serving remote tribal communities as well, raising all boats, and really just making Alaska a long-term sustainable healthcare system that people will thrive in.